This is Senator Adam Hollier, and I'm excited to have a really important and super cool guest, Dr. Joneigh Khaldun. You may know her from the governor's press conferences where the governor affectionately calls her Dr. J. So, Dr. J.
Hey, thanks for having me on.
Yeah, no. So where are you from? Where'd you grow up? How'd you end up in your role?
Oh, yeah. So I grew up in Ann Arbor, but my parents are from the east side of Detroit. So they were high school sweethearts, Persian high school. And I'm one of three children. So I'm from Ann Arbor.
Okay. And how did you end up in this role being the go-to person during a pandemic around health as a Black woman, as people are talking about Black women's health issues separate and above those kind of things, and probably the only one of you in your role nationally?
It's a good question. How did I end up here? So, early on, growing up in Ann Arbor, I knew that I wanted to become a doctor. Quite frankly, I always tell this story where I remember my grandmother, who I knew she was sick when I was young. I knew she had a lot of heart problems, but I also knew that she smoked like a chimney, and I knew that that wasn't good for her. And I used to hide her cigarettes, literally, true story. I used to hide her cigarettes. It never worked. But in all seriousness, I really thought that if I could do more to help my community, to help people be able to do the things that would keep them healthy, then that would be a life stream. And so I decided to go into medicine.
Cool. So you are, we're about the same age, the same generation, and I know growing up in Black households, it was like you have three acceptable professions: doctor, lawyer, engineer, and you chose doctor. And obviously, I'm a disappointment to my family.
Well, my family has always been supportive. I don't know that they really, told me I had to be, one of these particular professions. Both my parents actually are nurses. I'm very proud of them. My parents, grew up in Detroit, moved to Ann Arbor. My dad actually used to work as a janitor at night and go and take classes in the morning during the day. So I know my parents, my family have been incredibly supportive and proud of what I do.
And I think now the number of people who are proud at what you do has probably got to be a lot, larger. I know that now people are like, hey, I saw Dr. J. You're talking, like when I told people we were interviewing, they're like, you're going to talk to her? She's so cool. I'm so excited. So Your world has probably changed a bit going from the health director in Detroit to now being in this role where you're very much so a more public face. How is that different?
I'll be honest with you. I don't know if anyone goes into public health to try to get famous or be on TV with the governor every week. I certainly did not. But I'll tell you, even when I was the Detroit Health Commissioner and now, I do this work because I think it's important that I use my background, my experiences. I'm an ER doctor. I have experience in the federal government. I was the chief medical officer of the Baltimore Health Department. And I'm a mother, and I'm a Black woman. I think all of those things put together makes me really, I think, uniquely suited to share an important message and to speak to folks who look like me and folks who don't look like me. I think I have a certain skill set, and I think it's an honor actually to be able to use my skills in the middle of the pandemic of the century.
Yeah, and it's funny that we find ourselves kind of in different roles than when we first met, right? So when we first met, I was a dad who was like, hey, my daughter has elevated lead.
Yeah.
And we were talking, because the health department of Detroit handles that, and you were still there and administering that program. And I was like, your team is fantastic. They came out, they talked, they showed us these kind of things. And I think in this moment, we can easily get caught up in, hey, there's COVID-19 and that's everything, without recognizing all the other little things that we still have to be conscious of. So what do we need to be doing? What do we need to be thinking about? What's the best advice?
Yeah, I mean, you're spot on talking about, we've got COVID-19 and that absolutely is on everyone's mind, but we still have lead exposure for our children. We still have high maternal infant mortality rates and that significant disparity between Black women and Black babies and white women and white babies. We have heart disease, we have mental health, we have the opioid crisis. I mean, there are so many things. These public health issues don't wait for us to catch up. They didn't take a break. And so that's why, to be honest, I'm really proud of my department and of course, Director Robert Gordon as well. But we've really been focusing on not just COVID, but still making sure people have mental health supports, making sure we're building out our lead screening programs and making sure our medical providers are testing kids for lead. All that stuff is still here. And some of the things that we're working on with COVID, making sure people have access to food and transportation, making sure they're getting a test, not just for COVID, we're going to be making sure people get a flu test and they're connected to a primary care provider. Those are all important things. Again, public health issues don't wait for us. They continue to be present, and we're laser focused on it.
Cool. So what is the most up-to-date info on COVID-19? I know you just had a press conference with the governor. What should people be doing? Can you distill it in a way that it's like, do this to, for your grandma, for your parents, for your mom? Like, I think it's been funny as we interact with our families. There was a moment where our parents were not taking it sufficiently serious, and now they're serious, and like kids are now like, I can do anything. I want to do it. It's like, no, you can't.
Yeah, that's right. I mean, we're absolutely not where we were in the spring, where our hospitals were overwhelmed in Southeast Michigan. And the governor was able to reopen the economy in June, and we started seeing increases in cases in June and July. What's important is that we have started seeing a plateau in cases across the state, but it varies by region. The most important thing that people can do is the basics. Wear a mask, wash your hands, maintain your physical distance, that's 6 feet from other people. And please don't gather in large crowds and don't have these house parties. We have people.
So when you say large crowds, that is, I mean, because honestly, when I see 3 people, I'm like, good. I hope you all live in the same household, What is a large crowd today?
So, it's all about the level of risk, right? So ideally, you're only interacting with people from your own household, and they're doing the right thing and not going out and interacting with other people as well. But we know we have to be somewhat reasonable for folks. So right now in the Detroit area, for example, it's indoors, less than 10 people. It's large crowds. If you're outside, no more than 100 people. It depends on what phase you are in across the state. But to be honest with you, it's all about levels of risk. If you are in a crowded bar that's inside with a lot of people with no mask on, and you're not spacing out, all of those things add up. And the chances are someone in there is going to have COVID and it's going to spread. And unfortunately, we've seen that in Michigan, across the country. I think it's about people being smart. Also, to your point about young people are not immune to this disease. There are young children, babies who are dying from this. And I think it's also important to know, even when people are living, even if they don't have to stay in the hospital, the long-term consequences of having this disease are not to be minimized. People are having long-term problems with their heart, difficulty breathing for months and months after they've had the disease, and we're still learning more and more about it every day. So young people are not immune. They can get it, they can get very sick, and they can pass it to other people. And that's really important.
Okay, so let's talk about some of those kind of things, because I have a nephew who is a college football athlete at Eastern. The MAC obviously canceled their season. You've seen different issues with MLB and them, having to cancel games or do all those kind of things. You've seen players with kind of these long-term issues, where I think there was this moment where people thought, oh, you're young and healthy, you're going to be just fine. Or this idea that only the death toll counts. Can you talk about the impact that people who get this, what this virus does to people, and why everyone at every age, whether they are toddlers or adults, need to be cautious?
That's right. So I think it's also important. We're just learning about this virus. It's a new virus. It hasn't infected humans before. So whereas there's other viruses where I can go and I can open up a textbook and it'll tell me exactly what the potential long-term impacts will be. It'll tell me exactly how to treat it, what to do. Maybe, 10 years from now, we'll have that textbook, but we don't have it now. So we're learning more and more. We're looking at studies that are coming out. So what we're learning is even young children, even if they potentially may not spread it to others, and some of that research is not quite 100% clear yet, even if a child gets infected, we're seeing something called multi-system inflammatory syndrome. So it's called MIS-C, where children are having like complete organ shutdown and they're in the hospital. So again, something that's very, very severe. Even young people, we've got young folks who are young, healthy, in shape, in their 20s, no underlying medical conditions, who get the disease and are dying, or they have long-term consequences like their heart. So their heart muscle can be impacted. And then that's a long-term, lifelong issue that you have, because now your heart muscle has been weakened because of this disease. We don't know how any one particular person is going to respond when they get it. And that's why it's just important to try not to get it. Like, don't roll the dice. Be smart. Like, I know we're all tired. We're tired of wearing these masks. We're tired of not being able to go where we want to go.
I love my masks. I've got them in different colors. I'm
You
styling.
see?
They're working on my lungs. You know, it simulates elevation. I mean, I'm training all day.
Love your mask and get one for your kids. You can get little, you know, someone said there's a Paw Patrol one. I'm getting pink ones. My daughter likes pink, so I'm getting her pink ones. You know, like, just wear the mask. The more we do that, the more we'll keep these cases down.
Yeah, today was the first day. So my daughter will be 3 in December, but today was the first day she asked for her mask. Normally she's like, I don't want to wear it. Because, you know,
Look at that.
she doesn't fall in that like need to wear, but we're trying to get her accustomed to doing it. And, you know, I think just seeing other people wearing them, because they're starting to wear them at daycare. Because what
right.
age should kids be wearing masks?
So per the CDC, it's age 2 and up. Anyone who is able to medically tolerate wearing a mask. And I'll be honest with you, there are very few conditions where I can't even think of any really where someone would not be able to wear a mask. And if those conditions exist, those people are probably in the hospital right now anyway, if they really, really cannot wear a cloth mask over their face. So I'm sure there are some people who may not be able to wear it, but most of us can and should.
And when you say a cloth mask, that's different than, say, wearing like an N95 respirator, which can be a little bit harder to breathe or, you know, have a tighter seal than just a cloth respirator.
So there's different types of masks. Yeah, I wear an N95 that you just showed. Every time I work in the ER at Henry Ford, I wear that mask the entire shift and do not take it off. And I can breathe just fine, by the way. So you know, but it's all about how much the mask actually prevents particles from getting through. And so the N95 has a much higher level of blocking, if you will, of those particles. But even a cloth mask, and it's important actually, it's an important point, that ideally you would have a cloth mask that has multiple layers. You can get these on Amazon, 2, 3, 4 layers. There's even ones where you can put a little filter inside between the layers of the cloth mask. You have one there?
I don't, but I've got a whole box of filters and all kinds of stuff. I'm like, I've got N95 masks all the time because, you know, I do handy projects. So I've been finding masks and, you know, paint respirators and all those kind of things. But,
Okay.
you know, we're a little DIY family. So even my niece was sewing masks. And so she was making masks and then using like the HEPA air filters, you know, inside a little pouch inside that. It's like, you know.
Whatever it is, I mean, masks work. They can decrease spread up to 70%. They protect you, they protect the other person. It's something simple. I mean, the concept of masks, we've been using them before COVID in hospital settings for a while. You wouldn't have a surgery where your surgeon's not wearing a mask, you know? So I think the concept of questioning whether masks work is actually, you know, a little concerning for me. It's a very simple concept. You block the viruses from spreading, and that's how you stop the disease from spreading.
So, I mean, I really appreciate you kind of weighing in on what people should be doing with COVID-19. Are there other things that people should be doing? Like, I hear a lot of discussion about healthier people are safer. What kind of things should, you know, if people are trying to live their best 2020 life or their best quarantine stuff, you know, you hear a lot of folks who are like, all right, I'm going to get back to exercise. Are there particular spaces or things that if people got healthier in, they would make a big difference? I did a panel with another immunologist, someone who does who deals with pandemics or whatever, was talking about that the biggest predictor was obesity. Is that the case? Or like, what are the kind of things that people should be working on to mitigate their own spread or their own danger?
Yeah, that's a good point. So again, we're still learning, but it does look like people who have underlying medical conditions are more likely to succumb and have more severe disease, if you will. But there's also studies out where, especially if you look at the disparity, there's studies out, one out of the University of Michigan, that actually show that it seemed like the mortality rate between people who had the disease, whether you're African American or white, was the same, but it was more about the risk of exposure. So African Americans, and that really drives home a point. It's not so much that there's nothing about the color of someone's skin that makes them more susceptible to COVID-19. It's about, are you able to have the support so that you can work from home, so that you can have a private car, A lot of essential workers, lower income workers tend to be disproportionately people of color. So those are the types of things that we have to be concerned about when it comes to disparities. But to your point, exercising, eating well, those types of things are incredibly important. And I think too, we need to think about our mental health. COVID-19 is hard on everyone. It's really important that we focus just as much on our mental health as our physical health. Take a break. Being on Zoom calls for 12 hours a day is, can be stressful. I do it more than 12 hours a day. But take some time, ride your bike, go for a walk, take time to do meditation. We have resources on our michigan.gov/coronavirus website. I started up yoga again. I got an app and now I'm doing yoga. I haven't done yoga in over 10 years, but I'm doing yoga now. We have to take good care of ourselves physically and mentally.
That's awesome. And so as you talk about kind of the mental health and the access space, you and the governor have been able to do something that is pretty unique in declaring racism a public health issue. Can you talk a little bit about not only how you got there, but how what it's like to be the person to actually execute and to do that and to be, a Black woman talking about these things?
Yeah, and I just commend Governor Whitmer, Lieutenant Governor Garland Gilchrist. I mean, we also have a diversity, equity, and inclusion council at MDHHS who has really been just behind the scenes for years working on racism and implementing policies. I can tell you there's no question that racism is a public health crisis. When I told you earlier that there's nothing about the color of someone's skin scientifically that makes them more likely to get COVID or heart disease or any of these other things, it's policies. It's policies that are put in place by people who have power, who basically may have implicit, so unconscious biases against people who are not like them. Sometimes it's even people who look like them. So there's no question that when you have health conditions where we know they impact a large segment of the population, we know they are preventable, and we know there are things that could be done to prevent them that aren't being done, that is the definition of a crisis. And so that's why I'm so proud of the governor for declaring racism a public health crisis.
Cool. Well, it's honestly, it's super cool to just be able to talk to you about these kind of issues and to do that kind of stuff. But I think people would also be really interested in just who you are. Right. I think it's really nice when folks get a chance to see people like you who have gotten to a particular space and are a trailblazer and do those kind of things. But everyone wants to know how you did it. Like, how did you get your first job? How did you move from one spot to the next? Like, if you're a 19-year-old and you're like, I want to be Dr. J, what do you do? What advice do you give them?
Yeah, I think the important thing, going back, and I'm always bashful about talking about myself, but
Black woman, like there's this innate humbleness that you have that we've got to get you out of.
Yes, I'm working on it. But I can tell you, I've always known that I had some type of special quality and passion for keeping people and communities healthy. Mm-hmm. And I always wanted to focus on doing things that made sense for me and what I wanted to do. So again, I decided I wanted to be a doctor. It was hard, the classes are hard. You have to be patient. It takes a while. It takes a lot of school to become a physician.
So where'd you go to school? Let's start there.
Yeah, I went to school at the University of Michigan. Go Blue. So yeah, across the street, not necessarily across the street, but in my same hometown. I ran track there.
Oh, did you?
I was a long jumper and hurdler at Ann Arbor Pioneer High School, and then I went on to run track at the University of Michigan. Actually, I was
how fast you were.
I was a hurdler and long jumper. I lettered too. I lettered at the University of Michigan. So yeah, and then I left after undergrad, and I went to the University of Pennsylvania in Philadelphia for medical school. And so then I spent 4 years there. And then I decided that I wanted to be an ER doctor, and I really wanted to support my community. I wanted to do inner city kind of county style training. And so I ended up at Kings County Hospital in Brooklyn, SUNY Downstate, where I did my emergency medicine training. And I'll tell you, that is one of the most important experiences of my career. I mean, they used to send Army medics to Kings County's ER to train them before they would go off to war. And just some of the most, I think, dedicated, brilliant clinicians there. And really, I just enjoyed working with the community. but I'll tell you how I ended up here. I know you're trying to pull it out of me. So I was
super excited about this track and field. I had to look over and see if I could Google some of those things, but I didn't quite get there. But at some point, I'm gonna find.
Well, that's because I'm not telling you my maiden name. That's why.
Ooh, that's a good one. So sneaky.
Joneigh Slaughter. My last name in those days was Slaughter.
Okay.
And so, someone has found that out recently on Twitter, and so they have actually published articles about Joneigh Slaughter and track and field. But in all honesty, how I ended up kind of pivoting to a career in public health. Most doctors, you go to undergrad, you go to medical school, you do residency, and then you practice medicine, you see patients, you might do research, and then that's your career. And that is a noble career. I have many friends who do that. But for me, I always wanted to be at the table. I knew that seeing a patient in the ER who you got high blood pressure, you ran out of your medications, you don't have a stable place to live, I can't do anything for you in the emergency department. But if I could be on the outside changing policy, then I knew that's where I wanted to be. So I ended up in DC after residency. That's where I got my master's of public health in health policy. I had an opportunity to work in the Obama administration in the Office of Health Reform with many of the people who actually had drafted the law. And fast forward, ended up being asked to be chief medical officer of Baltimore. Somehow ended up being asked by Mike Duggan to be the Detroit Health Commissioner.
Let me stop you right there. So somehow, okay, so you went to the University of Pennsylvania for med school.
Yes.
An Ivy League school, very difficult to get into for all of you who don't know. So it's not just like she went to just some random school anybody gets into. She went to a very difficult, prestigious med school. Then is very successful in a very difficult hospital that sees a lot of cases where people are always looking for the best to steal them. And then we're successful doing that. And then you were successful at your next spot, and someone was like, hey, who is the best? And they found you. It wasn't like random, this is somebody. So along the way, I would always get involved in, you name the community effort, I was always involved in. I actually met my husband when I was in medical school. It's funny. I was involved in all kinds of community efforts in Philadelphia. I was just everywhere. I would go to class too, don't get me wrong. But my husband at one point said, are you in medical school? Are you like in community advocacy? Like, what are you doing? And I told him, and he reminded me, a few years ago before we moved back home to Michigan, that, I told him that I wanted to be a doctor so I could help my community, and that I love the people in Detroit and Michigan, and that's what I wanted to do with my life. And so to your point, I always just found a way to use my skills to better the community, whatever that community was, wherever I was living at. And so when I was asked to join the then Baltimore Health Commissioner as her chief medical officer, again, I'd worked in the DC community on youth violence. I'd worked on various public health interventions in DC and Brooklyn. And so I guess, built my resume a bit and developed a reputation so that when that person, was looking for a chief medical officer, she knew someone who knew someone and said, you got. Oh, I think we froze a little bit. Are you there? Is that me? Dr. J, did I lose you? Let's see. Hey, sorry about that. Are you back?
All right.
Sorry, we're having a pretty large platform, I guess, and it just was like, internet, no. So I guess that's the world. So now I'm using my iPad tethering for Wi-Fi.
All right, got to be nimble, flexible during COVID.
No, we do. I just want you to know that I'm going to share my screen because I found you back in the day getting your long jump on, and
Uh-oh.
it's amazing.
Uh-oh.
It is amazing. So couldn't find it at.
Yeah, I had some hops back in the day.
You probably still do. Can you see you? Is it showing that? Is it? I don't know.
No, that is me. That is me and my teammates, Becky and Robin,
Yeah.
my girls, 1995.
But yeah, I mean, that's just super cool. Like, I think for people, it's really cool to know that you're a real person, right? I think too often in our community, there is this expectation that people amongst us who are successful are these kind of robots and everything has always gone right. And they're like straight line and everything just happened. And so that's why I appreciate you being willing to share kind of your story, because there are a bunch of people out there who are like, that's what I want to do. And to be able to see that, not only that it took you working hard, but that you're a real person and they can do that. And I imagine that they could reach out and do that. I mean, that's got to be a different experience knowing that you are, you always meant to do your job, but necessarily now that you're this person that people aspire to. Like, do people recognize you when you're out and about? Like, how has your life changed in this moment?
Yeah, it's interesting. I now get recognized when I go to the grocery store, which is very new for me. And I've gotten a little used to it. I'll tell you, I tend to put on a little more disguise, like I'll put on a hat. So I noticed that my afro, that really is what kind of makes me stand out from other folks. But it's an honor. I've met so many people at the grocery store who who have shown me pictures of their loved ones, and we talk for a little bit, and it's to me it's really humbling, because I can see that one, people are listening to me, I guess, when I'm on TV, but that they care, they're hearing the story, and I see that I've been an inspiration for some folks. So it's really been an honor, to be honest.
In this week we've had a first in Senator Harris being brought on the vice presidential ticket, and people talking about that as a historic first. And you in your role are a historic first, and as we talk about these kind of spaces, what does that feel like? I mean, also yesterday was Black Women's Equal Pay Day, and for anyone who doesn't know, Equal Pay Day is the day that it takes a woman to make the same as a man. And yesterday, which was Thursday, August 13th, that is a man who made his whole salary in 2019. It would have taken all the way to August 13th the following year for a Black woman to make the same thing. And so, we saw some pieces talking about how a white male doctor is making $253,000 on average, and a Black woman is making on average $135,000. How do you feel about kind of this space, and what difference has you being in your role been able to play in changing that narrative and changing that system?
I am well aware that I stand on the shoulders of giants, and I'm not just talking about people who are public figures necessarily, but I'm talking about my grandma who had 9 kids and would walk miles to clean other people's houses and then come back and try to take care of her own family, working 7 days a week. I mean, those are the shoulders that I'm standing on. It is no coincidence that I'm here right now. I'm well aware of the sacrifices of my family, going back generations, and of other families, and Black women in particular, that have worked so hard to get where we are today. I'll tell you, I mentor a lot of folks, and I mentor people of all race and ethnicities, and I mentor men and women. But one thing I tell them, when you go into a job interview, know your worth. Know your worth. Go in there and tell them what you bring to the job, in case they didn't know already. Tell them what you bring to that position, and you ask for, do your research, and you ask for the salary that you think you deserve. What often ends up happening, to be honest, is that even if 2 people might be offered the same salary, the man tends to be more likely to say, no, I don't think so, I'm going to need to go a lot higher, where the woman will say, oh, okay, that's great, I want this job so badly, I'm just going to take the first thing that's offered to me. So I think, especially as women, we need to be confident, we need to know our value, and not be afraid to ask for what we want. That's what I mentor people on, and that's what I've tried to do in my career as well.
Well, that's excellent advice. to be able to sell people to know what their value is and know what their worth is. You know, in this moment where people are saying Black Lives Matter, I often counter, but how much do they value? How much do you value? What are they worth? Because that's the thing people have been unwilling to talk about. Most of the issues that we see could be fixed. They just come with a price tag. And people are unwilling to pay that price tag. They're willing to say, oh yeah, it's so important. We got to find equity. Well, equity costs things.
That's right. And it's why people who are in powerful positions, whether you just, oversee a small budget or a multi-billion-dollar budget, making decisions about what's important to you and having an impact on communities of color, that's something that people in power have to make the decision to do. And again, that's what the governor and lieutenant governor have done, and why I'm so proud to be in this administration.
Well, that's great. I mean, so thanks for taking some time and talking to us about this kind of space. Is there anything else we need to know about you? Is there anything else you want to, hammer home about COVID-19, about our health, about any of these other kind of things, services that you all are providing that people may not know about? What should we know from Dr. J? Maybe that'll be like a cool segment. Things you should know from Dr. J.
Yeah, let me just say, it's been an honor serving the people of Michigan in this particular role. It's been a long year. 2020 is going to be in everyone's memory. We may try to forget it, but it's been a long year. But we're not out of the woods yet. I know people keep hearing people saying that, but we got to take this serious. Focus on the things that you can control. You can't control everybody else, but you can control whether or not you wear a mask. You can control whether or not you're gathering. You can wash your hands, and you can just do the right thing. And so, again, I implore everyone, take care of yourselves, social distance, wash your hands. Don't forget to get your flu shot this year coming up. It's safe, it's effective. And then take care of your mental health as well. You can't separate your physical health from your mental health. And we'll get through this together.
And where would someone find more resources? I know you all have done a lot more around mental health and some of those resources. Where do people find the info? Where do they go?
The easiest thing to do is go to our website, www.michigan.gov/coronavirus. We have links to where you can get a free mask, where you can get a test done. We have all kinds of resources on mental health as well. And so I recommend people go to that website.
Speaking of testing, what is the best knowledge about testing? Should people be getting tested regularly? What should people be doing about testing? Oh, I think we're frozen again. Oh, no, we're good. Yeah. What should people be doing around testing? Should they get tested regularly? Should they get tested when they get exposed? I know it depends on their movement, but what's best intel about testing and the different types of tests, whether antibody, rapid tests, regular tests? You there? Can you hear me?
So that's a long conversation, but I can tell you, you're breaking up a little bit, but I think I heard the question. So the bottom line is we want everyone who needs a test to get a test. Mm-hmm. We've expanded testing where initially we were doing, a couple hundred tests a day. Mm-hmm. Now we're doing almost 40,000 tests a day, one day last week. We've got over 300 testing sites across the state. So it's important that, especially if people are working outside the home, if they have symptoms, if they've been exposed to someone who has symptoms or has known COVID-19, you need to get a test. There's many different types of tests. There's the one most people think about is the one that goes in your nose and kind of all the way back. Yeah. That's the diagnostic PCR test. That's kind of the gold standard, if you will, for testing. Okay. There's also antibody tests, which look for whether you've potentially been exposed to the virus in the past. Important to know about the antibody test, even if you have the antibody, it does not mean that you're necessarily immune to the disease. So just be careful how you interpret the results of that test. And then we also have some rapid tests that people are doing. Those tests tend to not be as good, but depending on what your situation, whether you have symptoms or not, whether you've been exposed, those tests can be a really valuable as well. So if you are sick, been exposed to someone who's been sick, or you're working outside your home, please do get a test. You can go to our website to find out how.
Awesome. Well, thank you so much, Dr. Khaldun, Dr. J, as the governor likes to call you. We appreciate you taking some time and educating folks, and we are all very grateful to have you in your role.
Thank you so much for all you do as well. It's an honor to be here with you today, and we'll talk again soon, hopefully.
I can't wait.
All right. Take care.